Hello again. The, the question to be answered in this video is, what is a healthcare system? Let's start the answer by defining what do we mean by the word system. So, a system can be defined as a group of interacting and interrelated elements that act according to a set of rules to form a unified whole. Think of the hospital as a system. It's made of a group of interacting elements, all the departments, the human resources, doctors, nurses, supplies, medications, uh, they act together according to the policies and rules of the hospital to form this unified whole we call a hospital. It's a group of interacting and interrelated elements that act as a unified whole according to a set of rules, like policies, to form a unified whole. A system has a purpose. It exists to achieve this purpose continuously. Healthcare systems exist to promote, restore, and maintain health. A system influences and it's influenced by its environment. Think of how significant to a specific community the opening or closing of a hospital can be. Think also of how the coronavirus pandemic had influenced almost every aspect of our society in the last 2 years. A system has inputs. These inputs are the resources that supply or support the processes of the system. Healthcare inputs are the providers of healthcare, individual or institutions, the information of the system, uh, the products and technologies, medications, drugs, computers, x ray machines, financial resources, the money that funds the system and keeps it running, the infrastructure, the facilities, the buildings, etc., and the governance, the leaders, the managers who maintain and manage and lead the system. Also, the system has processes. Any system must have processes. And these processes are all the things done to make the system fulfills its purpose. In the healthcare setting, examples of processes include vaccinating people, the giving of vaccinations to people. That's a process. Surveilling the community to identify underlying problems related to health status of population. Another process could be diagnosing the diseases. Healthcare providers spend a lot of time trying to diagnose the underlying problem. Then, based on that diagnosis, they prescribe treatment and they implement that treatment. And after some time, they evaluate the results of the treatment and more. There are thousands of different processes that take place in the healthcare system. Also, a system has outputs. System outputs are the results of the system operation. It's the desired results. In healthcare, outputs describe the change or improvement in the health status of individuals and population. When we say that the infant vaccination rate is 90% in a certain community, we are actually describing an output. When we talk about mortality rates, increasing or decreasing, when we talk about life expectancy of a certain group of population, when we talk about quality of life for those who are over 60 years old, we are in fact describing outputs of a healthcare system. Uh, for example, indicators of hospital outputs include inpatient bed days. Hospital keep an eye on the total number patients spend in a hospital over a certain period. Uh, Also, the average length of stay, the bed occupancy rate, the number of outpatient visits, and the number of operations. These are key indicators that inform hospital leadership of the outputs of their system. Lastly, any system must have feedback mechanisms. These feedback mechanisms provide the system with information about successes and failures. These mechanisms inform system leadership on quality improvement priorities. Thank you and meet you in a future video.